The Ontario Medical Association made some frontline doctors available to the media recently. Those on hand discussed the likelihood of a third wave and the steps we can take to ensure it's the last.
We need to continue to be creative in opening up that lab capacity to test not just for COVID, but for the different strains. I think I saw some other questions sort of in the Q&A around, well, how do we actually ensure that that's happening? And is there a lag between the lab reporting and it getting out into the public and into the data sets to be accounted for? Certainly, we have done an incredible job across the province in developing our lab capacity and also developing our lab capacity specifically to identify the variants of concern. There are multiple labs that are now testing as a screen the variant of concern from all the positive COVID samples. And then we are also expanding our ability to do genetic sequencing, which is actually not just to monitor the current strains that are circulating, but to identify when those newer ones become available and in circulating in our population as well. So what are some of the things that we can do differently? We definitely need to keep on top of what strains are circulating, and we definitely need the lab capacity in order to do so and the additional techniques in order to be able to differentiate between all the different strains that are circulating.
This conversation about economics versus health has to stop being phrased that way. You cannot have economic recovery in the middle of a pandemic. If we lifted all of the restrictions and just let the pandemic run its course, there would be economic devastation. And we cannot have recovery of healthcare and recovery of our well-being in the absence of an economic recovery. And so we've said this from the very beginning, but I feel like it's important to keep saying it. These two items are essentially tied. Your mental health and your physical health are tied to your financial well-being, and that is true for the entire province.
Right now, the evidence is that we really should just be very vigilant with the current measures that we have in place. As I mentioned, all of the personal protective equipment that we currently use to protect ourselves is actually working very well. But any small breach in it will actually, in fact, allow that virus to take advantage of that breach and move forward. And it may not even be a breach that you recognize or that it's intentional in its nature. And so it really is really being very mindful of wearing your masks properly. When you are sitting down to have your lunch and you're at work and you have to share that space with your coworkers, to really make sure that you've identified that you've spaced yourselves appropriately, and not just within the workplace, but then even congregating as you leave your workplace. So those breaks that you take outside, or the breaks that you take, or as you all leave the building to go home, it's really, really important that we continue to maintain that physical distancing and continue to wear our masks and continue to hand wash.
Getting residents vaccinated quickly and addressing vaccine hesitancy were two other points that came up during the briefing.
We really want to avoid that third wave, avoid overrunning our hospital system. This is a ticket. I mean, amongst many of the things that we talked about for sure, but like in terms of 80-20 or bang for your buck, wow, like let's get those vaccines out. And the other thing too, so I mentioned earlier, I'm just going to say it again, address hesitancy now. Don't wait till the vaccines are in hand. Address it now and be ready on the ground. We have that plan already. Don't be caught up in the red tape of, who's going to next. Like, just get it out as soon as possible and anticipate who's going to need it. And really, this is not the time for politics. It's not the time for, it's the time for get the vaccines out to those that are in greatest need.
The OMA website is a great resource for COVID-19 information. You can find them at askonteriodoctors.ca. In Niagara, you're watching The Source.
And so looking at how relief can be.